Dr. Jeffrey Bland, who's not only an extraordinary scientist and innovator and entrepreneur, but a really close friend and my mentor who literally set me on the path to functional medicine. He's written 120 peer-reviewed papers on biochemistry and medicine. He's self-published the Functional Medicine Update for more than 30 years. That's an audio program interviewing top scientists and thinkers and clinicians from around the world. I personally listen to that tirelessly. I would listen to it on cassette tapes, and it was so complicated that I would have to hit rewind, and thank God for rewind. And finally, one day I was listening to it, and all these concepts, all these theories, all these ideas just crystallized in my mind. And it was like understanding a language, studying all the words and the conjugation of the verbs and the nouns, and then finally actually going, oh my God, I understand what he's saying. So I want to just welcome you, Dr. Bland, to the Doctor's Pharmacy.
Oh, well, just a second. Before we go any farther, Mark, I'd like to just take a moment. First of all, thank you very much. That was a very gracious introduction. But actually, the most important thing for me, and I want to emphasize that between you and me, was your recognition of you being mentored by me. There's nothing that is more gracious nor, for me, impactful than you to say that, because as a leader of our field and a person who I have such great respect for in your clinical wisdom and the people around the world, literally millions of people that you've helped with your work and your teachings, it's obviously to be given some attribution as part of your learning curve is a very high level of flattery. So thank you.
What was really fascinating to me was that your ability, and this is, I think, really unique to you, is you have this incredible syncretic mind. You can synthesize enormous amounts of data across all sorts of disciplines, and you read across disciplines, which most people don't. The neurologists read the neurology literature, the cardiologists read the cardiology literature, but you're reading everything and you're seeing patterns in the data that no one else has seen. And decades before anybody's talking about these ideas, you're bringing them to us, and then we're trying them and they're working. Things like insulin resistance, or talking about inflammation, or leaky gut, which we used to be laughed at for talking about, dysbiosis, which now you hear in major medical conferences in gastroenterology, which was, again, a quack term. You talked about omega-3 fats. You talked about heavy metals and environmental toxins, about mitochondria. These are all now these emerging concepts. Bill Gates just gave $50 million to the Dementia Discovery Fund to fund inflammation research and mitochondria research in dementia, which nobody was really talking about. So how do you kind of do this? How do you kind of create this in your mind, these connections, and how did you come up with these discoveries?
Well, thank you. That was very, very gracious. And, I'm part of this remarkable community of which you're a central member, which is this functional medicine community of really motivated, take-no-prisoners, self-learners, which is a perfect environment for me, obviously, because of the way that I think about things. But if I was to go back to the origin of how I got here, each person has their central features that they've been motivated by or been instructed by or they've wanted to model after. And I've been very, very fortunate to just be lucky to be in places to meet the right kind of people that stimulated me. So
the ability that you have, though, to go into the literature and read across disciplines and see trends. I mean, like we've talked about this before, but now the microbiome is this incredible field of discovery and wonder and treatment. And I mean, they're talking about using fecal transplants for autism and Alzheimer's and fixing the gut as a way of treating autoimmune disease and treating obesity and diabetes and cancer. These were ideas that you were teaching us 30 years ago. And nobody was talking about it. Nobody was talking about permeability, leaky gut. I mean, how did you kind of come to recognize that the gut was the center of so much of what's wrong with us?
Yeah, so isn't it interesting, and I'm sure what I'm going to say you will identify with in your search and pursuit of understanding as well. So once you start opening yourself up to not invalidate anything you learn, to say, oh, that's an interesting concept, I need to know more about it, rather than to say, well, I don't know about it, must not be that useful, because if it was, I would already know about it. Mm-hmm. So once you open yourself up to that, and the reason I think a lot of people don't is it can be pretty complex if you're receptive to all new information. Because then you have to learn how to filter. You can't be a sponge or you just be all saturated. But then how do you filter? By being open to every new thing that someone says to you, so you don't reject it right out of hand. So someone says something you think is audacious, rather than just saying, well, that's stupid, I'm not even going to give it consideration. You say, well, that doesn't sound like anything I know, but maybe I'll look into it. That's a whole different approach.
Yeah. Curiosity.
Well, and then taking off the blinders of saying, maybe I don't know everything I think I know.
Yeah. Well, that's what R.D. Laing said. Scientists can't see the way they see with their way of seeing. They have a certain paradigm, and you only believe what you see, what you believe. You don't believe what you see. And that's the difference with you. You actually start to notice these patterns. So this whole field of the gut has been central to functional medicine. And I know for me, it's been the doorway to help so many people. It's always where I start with people, whether it's they have allergies or autoimmune disease or headaches or joint pain, whatever it is. If you start with the gut and help them restore their gut, so many things get better that you don't even have to treat a lot of things.
Yeah, I think that you have taught very, very eloquently and made it accessible to so many people the construct that there are certain places where our body interfaces with the outside world. Mm-hmm. And those places where our body interfaces with the outside world, there are antennae sitting on the surface of those cells that are interfaced with the outside world. So you think of the nose, you think of the lungs, you think of the skin, you think of the oral mucosa,
all the barriers,
you think of the gut.
Right.
These are the places where the body is interfacing directly with the outside world. And then how is it picking up that information, and how is it translating into internal function? That concept is a hugely frame-shifting concept that you never learned in medical school. It was all about how things break down and what do you name them, and now we're saying, no, hold it just a minute. The reason they break down and we give them names called diseases is because upstream, these interrelationships between the outside world and these receptors on the inside world, our body, are starting to get a message of be on guard, do battle, something hostile's coming, and our body's well designed to be able to do that, and then become an innocent bystander to our own reaction to it, which we call disease.
Yeah, I mean, it's really stunning when you think about how many, literally thousands and thousands, maybe hundreds of thousands of patients have been helped through your work and just highlighting these concepts decades before they're starting to catch on in the mainstream. And they're still so marginalized. They're still so peripheral. I'm at a major academic center, and, even though there's people there who are studying the microbiome, it hasn't translated into any clinical practice. And, functional medicine, for all its faults, has been brave in actually introducing simple ideas that have low risk but potential benefit and seeing amazing results. And I think that's why we're seeing 1 million people a year searching for functional medicine doctors on our website. That's a professional website. It's not even a consumer website, and they go there and they try to find doctors. Or we have 3,000 people on our waiting list at Cleveland Clinic because people are really hungry for a different way of thinking. Even if they don't know what it's called, they want to get to the root cause of things.
Absolutely.
And I think, this is really one of the principles that I think was the origin of functional medicine, was Linus Pauling's paper, Orthomolecular Psychiatry, which was published in Science Magazine in 1969, which laid out the concept that you could use nutrients to help push chemical reactions in the body that may be dysfunctional because of various factors, genetics or lifestyle or insults or chemicals or toxins, and actually get the body to work better. And that's really the principles of functional medicine, which is not to treat a disease, but to restore function and to take away the things that impair function. And when you do that, disease just sort of goes away as a side effect. I don't actually treat disease anymore. It's interesting to know what they have, and it's sort of a guide, like a signpost, but it's not the end of the story.
Yeah, I think you said it so eloquently. It's not only not the end of the story, it's the beginning of the story, right? Because it's not what you call they have, it's how they got there that's important. Right. And that's the whole nature of what we have learned about the importance of functional medicine. It's the journey, not the destination. Mm-hmm. And you can alter the journey to the destination by asking the right questions. If you don't know the questions to ask, you can never get the answers you need. And functional medicine teaches us how to ask a different set of questions than that which we were trained in medicine to ask.
Yeah.
And right. By the way, those questions that we are now asking in functional medicine will be the questions that doctors of the future will be learning to ask. But we're the front edge of that changing paradigm.
Well, we're seeing it because now these concepts are creeping into academia, and we're seeing, I just saw a lecture from a guy from Washington University in St. Louis, which is one of the top, most conservative medical institutions, and he's talking about the gut, and he's talking about using various nutrients and things to support function. And I think that's the difference. Functional medicine asks, how do we restore function? And medicine asks, how do we treat dysfunction? And that's a very different question.
That's exactly
and it's,
right.
In a sense, medicine is the science of disease, whereas functional medicine is the science of health.
That's exactly right. So let's go back to the gut for half a second. So this
my
week,
favorite topic. They used to call me Dr. See Every Poop at Canyon Ranch.
That's beautiful. So let's talk about this week. A colleague who is at UCLA, Elaine Chao, SHAIO, just published a paper on the cover of what is reputed to be probably the most prestigious basic science journal in biology, called Cell. That's the name of the journal. And this cover article is revolutionary. I mean, it's a showstopper, in which she has found in two very highly respected animal models of seizure disorders and epilepsy that there are two microbiome members of the community of the 1,000 or so different kinds of bugs that live in our gut that are directly associated with seizure management in the brain. And she has done such a great detective work. I won't give too much kind of detail here, but let's just say her detective work has been able to find out exactly the molecular process by which the gut bacteria, these two bacteria, can communicate with the brain in such a way as to manage seizure disorders. Now, if you were to have said that just in passing 10 years ago to someone that, by the way, that your gut might have some impact on seizures, you would have been saying you need a prefrontal lobotomy or something.
Right.
But now the science is absolutely irrefutable. It is so powerful. So the things that we have been, as you mentioned, describing, maybe without all the precision that we need, now are opening up with these new tools to be absolutely proven correct.
It's like you had that coloring book that was, like connect the dots and then color in, We had all that, but we didn't have the color yet.
Yes,
and now we're getting the color filled in on the picture.
So it's all part of a large system, and that's the way that we think, right? We're always into
systems,
and that's why for you and I, it is so frustrating when we hear, like, let's say a woman patient comes in and she has osteoporosis and atherosclerosis, and she has arthritis, rheumatoid arthritis. So he has 3 different medical conditions with 3 different diagnoses seen by 3 different subspecialists with 3 different sets of medications.
Yeah.
And then you ask, well, why does she have...
Pill for every ill.
That's right. And then we ask the question, why does that woman have those 3 conditions? And we say, well, it's just the bad luck of the draw.
It's
the poor woman.
comorbidity, meaning they happen to randomly be associated.
That's exactly right. That's the way we rationalize it in medicine, comorbidity. When now, as we know from functional medicine, they share a common lineage of their origin. And it's highly probable, based on certain dysfunctions, if you treat the dysfunctions, you're treating all 3 of those conditions.
Well, that's it. I think that's the challenge. We are so specialized, and we don't understand across our specialty what matters. And I couldn't choose a specialty, which is why I went into family medicine. I'm like, how could you treat apart? It's all one thing, right? And you often don't have to treat each thing individually. You just treat the system, and the problems go away. Like this one patient that's coming to mind who I saw at Cleveland Clinic recently, who had psoriatic arthritis, which is a terrible disease. She was on a drug that cost, $50,000 to $80,000 a year. It still wasn't helping her. A little bit relief of pain, but not much. She still had all the skin lesions. She had irritable bowel, bloating. She had reflux. She had migraines. She had depression. She was overweight, had prediabetes, had insomnia, anxiety. This one was like a 48-year-old executive business coach and was just struggling. And she was on medications for depression. She was on medications for reflux. She was on medications for irritable bowel. She was on medications for migraines. She was on medication for psoriasis. She was like on everything. And I'm like, just listen to her story. And I'm like, wait a minute, these are all inflammatory problems. And if we don't deal with the cause of the inflammation, we can take all these drugs to shut off inflammation or deal with the symptoms and not really deal with the problem. So I said, well, let's just start with your gut. Let's just put you on an anti-inflammatory diet. We'll get rid of inflammatory foods like gluten and dairy and sugar and processed food. We'll give you whole foods. We'll give you some things to reset your gut. I treated her with bacterial overgrowth treatments and an antibiotic that's not absorbed and any fungal because of all the drugs she's taken, the steroids. And I gave her some support like vitamin D and fish oil and curcumin, not a lot of stuff. And 6 weeks later, she comes back. She's not because I told her to, but she got off all her medication. She was completely symptom-free. She lost 20 pounds, and she felt great. And it wasn't that she needed all these different specialists giving these different drugs. She needed someone to understand how to reset her system. And by just working on the gut, she recovered. It was pretty amazing. And we see these stories over and over again, and people go, well, this is just an anecdote, or it's, maybe it's spontaneous remission, or it's whatever. But after 20 plus years of doing this, and you've heard, thousands of stories from thousands of practitioners over the whole globe, this is real, and it's not going away, and it's actually starting to infiltrate into medicine, which is pretty exciting. And it turns out that, these ideas that you taught us about, inflammation, the gut, mitochondria, toxins, hormones, structural systems, membranes, interfaces, these are all these seminal ideas that now are we're peeling back the veil in science and going, now we're really understanding these things. You've got like Dr. Alessio Fasano, who is also on the Doctor's Pharmacy, and was talking about this idea of leaky gut and these membrane and barriers that break down and the discovery of the scientific mechanisms behind it. And we kind of knew what was happening. There were shadows, but now we actually can see things in full relief, and it's pretty amazing.
Yeah, and think about what you just said there, the power in that sentence, that we have now starting to understand, I don't want to say complete understanding, but we're starting to understand that this outside world, the things that we eat, that come from the soils and the environment from which nature nurtures, have an inborn communication connection to our body's receptor systems that signals through every DNA molecule that creates our function. Now that is a paradigm-shifting concept, that we're connected into the soil, into the air, into the water, into the sun, in ways that are directly tied to these biological processes that we call intracellular signal transduction, for which we are involved in matrices, not disconnected from the world, but an integrated part of the network of the world into our biology.
Yeah, I got to unpack that because that was deep. So what Dr. Bland is saying, and I've been his official translator for 20 years, is that we are constantly in communication with everything, with the sun, water, the air, the earth, with environmental toxins, with our food, which is the biggest thing that we deal with every day. So this is really information science. Biology has turned into information science and understanding how do we interact with all the information that's around us and in us, and all the microbes in us, all the food we eat, and that this is far more relevant than trying to just categorize people into groups around diseases and find the right drug for it. And once we understand that this complete dynamic crosstalk of information is actually driving all the things we see, then we have a whole new way of not only thinking about it, but treating people from these first principles and seeing extraordinary results when we never imagined possible. I mean, I remember, I saw someone with autism, I don't know what to do with autism. I'm not trained in autism, but I just said, well, let's just get these things in balance. And people started to recover. Or someone with Alzheimer's who came in who was sitting in a corner drooling and depressed and demented, and turned out he had severe mercury poisoning. We just looked, well, let's look at the things that are out of balance. He had insulin resistance. He had methylation issues around folate and B12. He had mercury. He had a lot of gut issues and bacterial overgrowth and leaky gut and inflammation. I said, well, let's just calm all these things down. I don't know what's going to happen. And he recovered. And I'm like, this is extraordinary. And I was able to do that based on using these concepts that are out there in the science, but that no one's using, and using the lens of functional medicine, the things that you've helped us know and understand, and really just getting people to sort of do those simple things that make profound difference. So it's changing the information.
Yeah.
And that food is information. Everything is information. Yes. Exercise is information. Sleep is information. Food is information. Thoughts are information, and these are all communicating with every cell and every system in your body every second. And when you understand that, then it's enormously empowering, because then you can do something about it.
Precisely.
So for you, Jeff, every day you run around, you do all these things. How do you stay healthy and sharp and good? What are your non-negotiables? What are the things that you just have to do to stay who you are?
Well, I think the first thing that probably stands up for all of us that have survived, in my case, probably more than now 6 million miles of air travel over the years, is to remember that you have a responsibility to yourself to be the best you can be for the rest of the world. And it's not a sprint, it's a distance run. I mean, I've seen many of my colleagues that I've been with over the last 40 years that saw it more of a sprint, and they're no longer participating because they burned out. And for me, it's always been the long run, because I knew that
the ultra marathoner.
That's right. And so, you overdo at times because you have to do certain things, and then you have to find balance. And let me give you a good example of that in my life. So, and I have a good partner that reminds me of this. She's very good about putting the stops on and reminding me. So I would really been forcing hard, like we all do, to get some things done, probably overextended to say the least. And then one day I came home and she said, well, here are your bags. We're packed and we're heading out. And I said, well, no, we can't. She said, no, I've already taken care of your schedule. And so, she recognized that really had to, and it had to be unplugged from cell phones, and it had to be unplugged from computers and email, and we were going away. And so that became kind of a pattern of our living in the 30 plus years that I've been married with her, in which, for instance, on our 60th birthdays, that we share the same year of birth, we made the decision that we were going to take the whole summer off. Now, taking the whole summer off when you still had all the responsibilities that I had seemed impossible, but then I had a whole year to plan. So I basically decided to bring in people to help me to take over a lot of my responsibilities, and we took 3 months and traveled to Alaska in our boat together and with our animals, and we flew in, the kids flew in and out, but most of the time we were just the two of us together in the most romantic environment, just seeing nothing other than animals and blue sky and forest for 3 months, and that then empowers you to be best in the long distance. So I think that's where I would start, is finding the right balance points and recognizing that it's not a sprint, it's a distance run. Secondly, then once you've got that kind of rhythm, then what are you going to do? You're going to make certain things about your diet and about your exercise program and about your sense of responsibility to yourself as very high priorities and, as you said, non-negotiables. So yes, there's always going to be a little bit of slop around the edges and certain things that you might say I don't want to do that you'll do periodically, but in the main you should stick by certain rules. And for me, they're rules that you've been talking about so eloquently for quite a while. The sugar reduction, the management of calories, the using things that are close to the earth, the Michael Pollan way of eating, the regular activity. Even if I can't get a full dress to exercise in, it's at least walking an hour a day. Having a dog, which becomes your universal trainer. And my dog is very special in my life. I have a golden retriever that we run together in the woods, and so all of those things are part of becoming a rhythm. You wouldn't do anything else because it is your behavior, and I think you
just
invest
building
in the
those
long term.
habits of life that just are sustaining.
Exactly.
And you can go sprinting, but you have to know how to reset and recharge. Yeah, and it's all about understanding. How does your body work? You're a biological organism. And I see, like my nephew, for example, he's sort of disconnected from his own body, his own environment, because he's focused on his devices and his computers and his video games, and it's like he's not in the world of being an animal, which is we all are, whether we like it or not.
That's right.
Yeah.
Well, and I think that's the other. Thank you for saying that, because we are all unique, right, in our needs. So in my case, I know that I have a family history. My father's side of diabetes, and my grandmother, his mother was one of the first people in first generation to get insulin for her diabetes, and then my father had type 2 diabetes, and so I have to recognize that that's a factor. So I follow very closely my biometrics, and I'm always making sure I'm on the right side of the curve. And if I look like I'm straying, I can pull myself back. And so I think it's individualizing to your own unique strengths and weaknesses. It's very important.
Yeah, that's good advice for all of us. So, last question: if you were king for a day, and you could change anything in the world of health, healthcare, food, policy to make the world a better place, what would it be?
I would have a woman president.
Okay.
And I would bring the feminine into healthcare. The reason I'm saying that is that I think the command and control model that males generally like, because they like widgets and gadgets and devices, has been really, really great for technological development. And I would never say it's not been good for society and cultural evolution. But we're at a time that we need some new skills and some new ways of managing information, new ways of communicating, cooperating. We need less doing and more being. And I think that that's why the feminine might be a really important part of our future. So that's how I see it.
It's time. I think that's a great thought to leave on, which is understanding things in a different way than our very controlling and, like you said, command and control view. That's awesome.